Annika Fendler, Berlin Institute of Health. Combined inhibition of WNT and Notch signaling as a therapeutic strategy for human clear cell kidney carcinoma.
Good morning. The therapy of kidney cancer has been significantly improved with the introduction of targeted therapies 10 years ago. However, at the moment, most patients still progress within 2 years under therapy. This highlights an ongoing need for better and more refined therapies. In our study, we focused on human cancer stem cells to identify novel druggable targets. We performed gene expression profiling of human kidney cancer cells, which we isolated directly after surgery, of cancer stem cells, which we isolated by FACS sorting, and of sphere cultures, which enrich for cancer stem cells. In this gene expression profiling, the cancer stem cells clearly differentiated from the non-cultured counterparts. And most importantly, we identified 2 signaling pathways which were highly active, namely Wnt and Notch signaling. So we developed a sphere-based assay to test small molecule inhibitors directed against both pathways. In this example, of the Wnt inhibitor ICG001, you can see that the sphere formation was inhibited by the drug, yet not in all patients, which indicates cellular heterogeneity. In total, 71% of the patients responded to the Wnt treatment, and 63% of the sphere cultures responded to Notch treatment. For the 50% which responded to both inhibitors, we also observed a benefit when we combined the treatment. Most importantly, when we went back to the cancer stem cell signature in the sphere cultures, we could identify genes which would predict whether the cells responded to the inhibitor or not. We also developed a patient-derived xenograft to test whether the inhibition of cancer stem cells would also result in an inhibition of tumor growth. And you can see here in this example that the Wnt inhibition resulted in a strong reduction of tumor volume, and also inhibition of Notch signaling still had a significant effect. So to sum up, the cancer stem cells in kidney cancer are novel targets for cancer therapy, and we can block cancer stem cells and xenografts by inhibiting Wnt and Notch signaling. We also can subgroup the patients based on the response of the sphere cultures, and can subgroup these patients based on the gene expression signatures. So to sum up, our results indicate the advance of these inhibitors into clinical trials in the future. Thank you.